My patients ask me all kinds of questions about getting pregnant after having a miscarriage. So today, we're going over your most common questions about getting pregnant after a miscarriage. And stick to the end with me on this one because I'm going to talk about the common myth that you're more fertile after you have a miscarriage. And I'll tell you a little bit about my story and what I wish I hadn't done. Maybe it will help you in what you're going through as well. Hi ladies, welcome back to Fertility Mom. If you're trying to get pregnant at any age or history, then you're in the right place. So make sure you hit that little subscribe button and the bell so that you know when I upload new videos to you every week. We've got lots of stuff coming at you this year and I don't want you to miss anything. If you're new and you haven't yet been to one of my free classes, definitely hit the pinned comment below and register for my next live and free Fertility Masterclass. We go over a bunch of things that you can start doing that very day to improve your fertility. We also go over some really cool scientific breakthroughs that have been made in anti-aging for fertility and egg quality. So absolutely register for that and I'll see you there. Let's dive into today's topic about getting pregnant after a miscarriage. I'm going to be answering your most common questions, anything from when can I start trying again to when will I ovulate and a bunch of other things as well. The first question I usually get asked is how long do I need to wait after my miscarriage before I can try to conceive again? And the answer to this will vary and it will depend on the situation. Many doctors will give the standard wait 3 to 6 months before trying to conceive again, but the answer to this really depends on the situation. Number one, it will depend on whether the pregnancy loss was a chemical pregnancy, a first trimester loss, or a later loss, depending on whether it was second trimester or third trimester. And then number two, the answer will depend on whether or not you lost things naturally or whether you needed some sort of medical intervention like a medication or a procedure called a DNC or a dilation and curettage. My recommendations will vary depending on the situation because everybody's a little bit different, but generally speaking, this is where I land on this issue. If you've had a recent pregnancy loss and it was your first loss and it was either a chemical pregnancy or early first trimester, everything was lost naturally and no medical intervention was needed, then you're good to try again starting that very next cycle if you feel up to it. If you've had a later first trimester loss or anything after that required medical intervention, a medication, or a DNC, then I recommend you monitor with your doctor that there are no products of conception left inside the uterus. I've seen a lot of crazy things, so I'd like to make sure with scans and HCG blood draws that the HCG returns down to 0 and there's nothing left. Everything kind of returns back to baseline and there's nothing left inside that uterus. So I like usually to use ultrasound and blood draws to confirm that. You'll do that in concert with your healthcare team. And then once you feel ready, you can start trying again that next cycle. If you've had 2 or more losses, this is when I recommend that we take a step back and we optimize your body for a few months before going back to try to actively conceive. This might include some blood draws and some lifestyle optimization. It depends. It depends on what's happening. A lot of times I'll find some thyroid stuff and then some things underneath that. So we want to make sure that if you have had 2 or more losses, we're taking a minute, we're taking a step back, and we're optimizing you. I remember for myself with my recurrent losses, thinking the only way I would feel better about things or the only thing that would really help me heal was to get pregnant as fast as possible. But this ended up backfiring on me because I didn't take the time to reevaluate what was happening. I didn't take that time to get my body optimized, and it set me up in this recurrent miscarriage cycle where I would get pregnant, I would have lost, I would get pregnant again really quickly, and then I would have another loss. And it wasn't until, many losses in that I was like, yeah, I should probably be doing something different. So I say 2 or more, we take a step back and we optimize you. Let me know down in the comments if you've had a loss recently and what was the recommendation that your healthcare provider gave you. Did they give you that standard wait 3 to 6 months or did they have other recommendations for you? Another really common question that my patients will have after they have a miscarriage is when will I ovulate again and when will I get my period back? And again, the answer for this is going to vary, but basically within that 1 to 2 month range. If you've had a chemical pregnancy where you had that loss within that first 4 to 6 weeks of pregnancy, so before we're seeing a heartbeat on a scan, usually your body doesn't skip a beat. Usually you'll get your period maybe what seems like a few days late, your pregnancy test will go negative very quickly, and then you will head straight into a normal cycle. You'll ovulate, you get your period again that very next month. If you've had a later first trimester or anything after that, again, it will vary. Generally speaking, you should get your cycle back. You should ovulate and have another period within that 1 to 2 month mark. If you have not had a period within that kind of 1 to 2 month mark, if we're getting past like 2 months after a loss and you haven't had another period, this is when I absolutely recommend going to your doctor, making sure we have an ultrasound, making sure there's no products of conception left, making sure that we have an HCG level that has gone back to 0, just so we can assess and make sure, everything's here seems okay. Maybe our body just needs a little bit more time. Another really common question that I get about getting pregnant after miscarriage is, am I more fertile after having a miscarriage? A lot of women have heard this, they've been told this, that after having a miscarriage, they're actually more able to get pregnant the next cycles or more fertile. And there is actually no good, solid scientific research or scientific data, no gold standard certainly, that backs up this claim. So in the end, I think that this myth doesn't carry enough weight. There's really nothing to back it up. And that's why my recommendations about when to start trying to conceive needs to be based off of you and your situation. It has nothing to do about whether you're more fertile in the coming months. So this brings us to what happened with me and my miscarriages, and what I wish I hadn't done after my miscarriages, and what I wish I had given myself time to do instead. I had 7 losses altogether, mixed between chemical pregnancies and first trimester losses, different varying lengths of them. And I believed that I was more fertile, right? I believed that I was more fertile after having a loss, and I felt that pressure, I felt that stress to try to conceive again very quickly. And a lot of times I did get pregnant very quickly, but then I would lose those pregnancies as well. And I also set up this timeline, okay, I just had this loss, the baby's due date was, March 22nd. If I'm pregnant by then, right? If I'm pregnant in my 2nd trimester, by then I'll feel much better. And I would get pregnant again, but then I would lose that baby. And so I was like, okay, well now I have this other due date, and then it happened multiple times. But the thing that I did was that I felt like getting pregnant again was going to be the thing that healed me from the pain of the loss that I had just experienced. And then what I found was that every pregnancy I went into after that was very anxiety ridden. Versus when I took a step back and I gave myself time to emotionally process the loss, grieve the loss, and then take the time to care for my body, optimize my body, make sure that I was doing all the things that my body needed so that it could get past that certain point in that pregnancy. Those pregnancies were better. Yes, they're still anxiety provoking. You're still going to have some fear in any pregnancy after you have a loss. But for me personally, a loss going straight into another pregnancy was much more anxiety provoking versus having a loss, taking some time to emotionally and physically recover from that experience, and going into another pregnancy, it was a little bit less anxiety provoking for me. So what I wish I hadn't done was I wish I hadn't set up these timelines, because it's additional. It's another blanket of weight. It's another added stressor for you. You've now given yourself additional time pressure, and you might already be feeling time pressure for a variety of different reasons. We don't need to extend that pressure on ourselves. So what I wish I hadn't done was I wish I hadn't given myself additional timelines. I wish I had given myself more time to grieve and to then physically recover as well. So if you've had a recent loss, my heart goes out to you. I know how you're feeling, and I really want you to take some time and give yourself that time to recover physically and emotionally. They're 2 different things, and they can happen at different speeds. So you might emotionally be feeling like, I really just, I want to start trying to conceive again, but your body hasn't recovered. Maybe you haven't gotten your period back yet. We still need to take some time. Okay, and vice versa. Maybe you physically recover. Maybe you got your period back right away, but you're emotionally not ready. Maybe you had a later loss. It depends on your personal experience. So take the time that you need, and then when you feel ready to, you can start trying to conceive again. That's it for me today, ladies. I hope you liked this video. I hope you learned something or took something from it. If you have any questions or anything that you want to talk about, hit me down in the comments. Make sure you like the video, subscribe to the channel, and hit the little bell notification so you can see all the new content I have coming out for you. And if you haven't been to the masterclass yet, make sure you register for that, and I'll see you there. Bye, ladies.